Let me know when we're live. Says we're live. Are we live? Ann, are we live? You're muted. Well, it says we're live, so I'm going to assume we're live.
Sorry, Doc.
Okay. Hello. It's 4 o'clock Pacific, 5 o'clock Mountain, and here in Costa Rica, 7 o'clock on the East Coast, midnight in Dublin and London, 1 a.m. in Milan and most of Europe, 4:30 a.m. Wednesday morning in New Delhi, 9 a.m. in Brisbane, Australia, and 12 noon in Auckland, New Zealand, and it's Facebook Live. Hello, everyone. It's really great to be with you. Let me know where you're coming in from. It's always great to see people from all over the world. I just had an experience, which is why I was a couple of minutes late here. I've never had such an experience before. We had some fellows who drove up here one day, a couple of guys, and asked if they could fertilize our plants, our outdoor plants. And we have a lot of trees and palm trees and fruit trees and things. And I said, well, let's do a couple of plants. And they did it a month ago. And after a month, they're just gorgeous. They're really beautiful. And it's all organic. They said it was organic. And they asked if they could come back and do the rest of the place. And I said, yes, because everything looks beautiful. So they came back and we asked how much. And the language barrier, I didn't think it was a barrier. He wrote down 90,000. And that's colones, which is about $200, something like that. And I thought, well, that's pretty good. Okay, go ahead. And turns out it was 90,000 colones per liter, per 10 liters. And they used 18 10-liter containers. The guy wanted $2,600. I'm like, what? No. So we just went on for close to an hour. And our friend, the supervisor, came over here to interpret because they don't speak very good English and I don't speak very good Spanish. And this went on and on. And I said, look, no one's trying to take advantage of anyone here. This is a misunderstanding. So let me give you each $100 for the hour and a half that you were here. And I'm going to buy all new raw materials for you. The 3 containers they mix to make this concoction that they make. I'll buy full containers for you, and this will be a learning experience. Well, they weren't having it. They want $2,600. And this, what? So then I called the attorney. They got the attorney on the phone with them, and it ended up, I said, look, that enough. I've got to go, because I'm hearing now about the ferry ride to come over here and the equipment they bought to spray everything. And I know that's utter nonsense. It's the same equipment that they use for every job they do. So we gave them $500 because I thought about it. If I were to, someone were to approach me about fertilizing this place, then I would say, well, I think $500 would be okay. So I gave them $500 and they eventually left, unhappy, but they left. But what an experience. And it was just a miscommunication. They wrote down 90,000 colones, but it was per serving. But he didn't say that, or I didn't understand that, because I said, what's the total? And I did the big circle with my hands. What's the total? And 90,000. Okay, good, go. So they did their work. So it got me a little riled up. And so I'm here with you, and I'm going to start maybe with, see if I can find my glasses. There we go. With a question or two, and then we'll get into today's. I just need to ground myself a little bit. So Ann, put the link for the Q&A in here. There's one in the Q&A, but put the link in for any questions we might have so I can just get warmed up and grounded, okay? So Anonymous writes, any idea why I continue to wake up nauseous and with a headache every morning? Ginger doesn't work. I have to use lots of ondansetron and sumatriptan. Have 6 autoimmune diseases, but seeing functional medicine doc for 4 years. Well, there's certainly a few different things it could be. The first thing, and it's something that I think everyone should do, almost everyone should do, and that is really get a handle on your blood sugar. What's your blood sugar like when you wake up in the morning? And the technology has improved so much for everyone that you can get what's called a CGM, continuous glucose monitor. It's like a nicotine patch. Put it on your arm and you download the app on your phone. You just put your phone up there. It tells you what your blood sugar is right now. And they work for about 2 weeks. So with every meal, you would be able to see what the impact is of that meal on your blood sugar. And when you wake up in the morning, you can see what your blood sugar is when you wake up. So that's the first thing that I would look at. The second thing that I would look at, do you have any musculoskeletal complaints, any back pain, neck pain, structural pain? You said you've got 4 autoimmune diseases. So if one of them is more of a musculoskeletal condition, or did you say 6? 6 autoimmune diseases. There could be a musculoskeletal component also. And as a chiropractor, which is what my initial training was, and we've seen many miracles over the years on occasion, if a structural problem was the main irritant causing that particular symptom pattern. So it could be your bed, could be the way you're sleeping. You know, there's a few places you have to look. But those are the 2 that I would look at first, is a CGM, see what your blood sugar is like when you first wake up in the morning, because that could certainly give you headaches and nausea easily all by itself. And the other is structure. Find out if you have a history of structural problems or complaints, that certainly could be a contributor in there also. So now, oh, that's right. Oh, my lovely wife is putting the light up because I forgot to turn the lights on for me. Thank you, honey. You can hand me the plug and I'll plug it in here. Look what happens when I get a little off my game dealing with these aggressive guys. Thank you. How's that for a light? Is that better? I would think so. Okay, now, what did I do with my glasses that were just here? Here they are. All right, let's see. I'm gluten-free 3 months, still have eczema, no sugar, no dairy, but insulin still making problems. Skin is better, but eczema around nose doesn't disappear. Okay. Being gluten-free and sounds like it's giving you no sugar, no dairy. So you're doing the gluten-free, dairy-free, added sugar-free approach. Great, good for you. Glad to see that some areas are improving, your skin, but the eczema is not better, and especially around the nose. Most likely, the first place I would look is you have to rebuild your microbiome. And especially when you've got eczema and things around the base of the nose, things like that, there's a couple things that might be suggestive of. One of them is a problem in the gut, possibly, is certainly worth checking. And the other with that kind of condition is a folate problem, not using your B vitamins very well. But I'd also look at the environment, moldy house, or too many toxins inside your body. There's a few different contributors that could be there, but those are the few that I would look at to begin with. Doodle Today says, absolutely nonsense. I have celiac disease. If you don't have a reason or gluten doesn't destroy your villi, no valid reason to give up gluten. Actual medical science proves this. Great, Doodle Today. Send me the science if you would, please. I'd love to say it's okay to eat wheat. And if you can show me some science, I'm not rigid. I don't want to be rigid. I miss my croissants. But when I read the science, every human gets intestinal permeability and increased inflammation in their gut within 5 minutes of these peptides of wheat coming out of the stomach into the first part of the small intestine. Every human. I mean, it's inarguable science. You get transient leaky gut and intestinal inflammation. Technically, it's called increased zonulin. That's the protein that causes leaky gut, and increased NF-kappa B, which is the major amplifier of inflammation. And Maureen Leonard at Harvard, a famous gastroenterologist, did a literature review of, I believe it was over 60 studies. I'm not quite sure if that's the accurate number, but it was somewhere over 60 on this one topic. And her conclusion in the summary of the abstract, even, and throughout the paper, is that all humans will develop transient intestinal permeability and inflammation when they consume gluten. And her comment is, this occurs in all humans who consume gluten. So whether you feel symptoms or not, if you're basing your conclusion on how you feel, you may be right. You know, people can go to Europe and eat the wheat and they feel fine, but they come home and they feel sick with it. So they think they're okay eating the wheat in Europe. They're not. They just don't feel the same symptoms as when they eat the wheat in the US, but it's causing the inflammation and it's causing the increase in the enzymes in their bodies. Not enzymes, antibodies, the autoimmune antibodies. So Doodle today on Instagram, I don't want to, challenge you, but I'd ask you, you're talking about the science. Great. Send me the science. And if you do, send it to info@theDr.com and they'll send it to me and I'll review it and I'll talk about it next week at Facebook Live. I'll say, Doodle today last week had this comment and they sent me the science and here's the science. And I'll make some comments on it, whether I can embrace it or not. But I'm really happy to have the discussion with you on it if you like. Pure Health Coach on Instagram says, is the number of gluten itself causing the problem some people, or the pesticides, glyphosate, et cetera? Really good question. And as I just mentioned, all humans have this reaction to wheat without exception. If you're human, this happens to you. Whether it causes symptoms or not is another discussion. Depends on where you are in the inflammatory index as to whether you get symptoms. Or is it going to be a few years before you've killed off enough cells because of the increased inflammation? When you eventually kill off enough cells, now you start getting symptoms. But for all humans, it's wheat. I never say that everyone needs to give up wheat. I don't say that. What I do say is if you have a health problem, then just check. Just check accurately, but then check to see, do I have a problem with wheat? And how do you know? How you feel doesn't matter. By the time you feel problems, that's pretty far down the road of degeneration, and some of you have heard me talk in the past about brain fog and brain deterioration and Alzheimer's, that the science is really clear. For 20 to 25 years, we're killing off brain cells because of increased inflammation in the brain before you ever have a symptom. And then you get mild cognitive decline and you can't remember where you put your keys and you say, I'm getting old. I don't remember the way I used to. And you say, how old are you? Well, I'm 36. And no, that's not supposed to happen. And the end point of that example, Blue Cross Blue Shield published in March of 2020, that there was a 407% increase in 4 years, 407% increase in 4 years in Alzheimer's diagnosis in 30 to 44-year-olds. 407% increase, that it's going up exponentially at earlier and earlier ages. So we can't base how we feel as to whether there's a problem or not, because by the time you feel it, you've pretty much done enough damage to where the tissue can't function normally anymore. And now you're starting to get symptoms. So to purehealth.coach, the question about, is it the wheat? Yes, it's always the wheat, but the glyphosate and the pesticides and insecticides make it much worse. To give you an example of that, some of you have heard me talk about the study that blew me away in the Journal of the American Medical Association, and the editors of the journal made a comment. They said, this is an elegant study using sophisticated biomarkers to prove their point. Now, the editors of the Journal of the American Medical Association don't say that very often. So that gave quite a bit of relevance to this study that really shouldn't argue with this study. And so I looked at this study. It's from Harvard, and they looked at couples at assisted fertility centers. And as you may know, you're spending tens of thousands of dollars to try and get pregnant and have a healthy pregnancy and a baby. And they ruled out all of the factors that they could think of that might interfere with successful implantation. They ruled out obesity and exercise or no exercise and cigarette smoking and alcohol consumption. And they ruled out everything they could and narrowed it down to one topic. How many servings of fruits and vegetables were they eating per day? Were these women eating per day? And the results were jaw-dropping. They divided the number of servings of fruits and vegetables per day into fourths, the lowest, the next, the third, and the highest. And when they looked at the results, they found those eating the highest amount of servings of fruits and vegetables, conventional fruits and vegetables, compared to those eating the lowest amount of fruits and vegetables, those eating the highest amount had an 18% less likelihood of getting pregnant. 18% less likelihood with the more fruits and vegetables you ate. But if you did get pregnant, you had a 26% less likelihood of a live birth. You lost the pregnancy with a miscarriage or stillbirth. Wait, the more fruits and vegetables I eat, the worse the outcome? Yes. Wait, what? That was one of those wait, what moments. Wait, what? You know, I had to read it a couple of times. And then they did the category of organic, those that were eating organic fruits and vegetables. And they divided them into fourths. And those eating organic fruits and vegetables was the exact opposite. The more servings of organic fruits and vegetables you ate, the better the result. And they were put in the category of organic consumption if they had 3 servings per week, not 21 servings purely organic all the time, just 3 a week. And then you were put in the category of the organics. And they had the exact opposite outcome. The more fruits and vegetables you ate, the more likelihood of success in implantation and a healthy pregnancy and a healthy delivery. Why? Well, it's the pesticides and the insecticides and the fungicides and the antibiotics that are in the conventional fruits and vegetables you buy in the supermarket. They're loaded. And every year they're more loaded than the year before. And I may be exaggerating, maybe it's every 2 years the measurements are going up with more toxic chemicals in conventional fruits and vegetables, but they're going up is the point. And these things can accumulate in your body. To the question earlier about waking up with nausea, you may have a high load of what's called endotoxin. It means toxins inside your body already. Could be mercury or lead or arsenic or organophosphates. You know, you have to check just to see, is my immune system fighting organophosphates? And the test for that is the environmental toxin test by Vibrant Wellness. And we'll put the links in here to the test. I'm going to talk about tests today. And Marcy just put something on the board for me to see here, which is really great news. 60% off all labs. And you use the code WHEAT, all capital letters, WHEAT 60 for 60.
It's $60 off, Dr. Tom, not 60% off.
$60 off. Thank you, Ann. I couldn't believe, because Marcy got that wrong. Thank you, Ann. I'm glad you intervened there. But $60 off all labs. And the code is WHEAT60. So if you're concerned about environmental toxins and endotoxin accumulation, which quite honestly, you know, I've talked to a couple of friends of mine who are very busy functional medicine docs, waiting list practices, seeing patients every day. And I've asked 2 of them in this last month, hey, when you do the environmental toxin test, how often do you get a negative coming back? And they just kind of pause and they say, well, I don't think I've got one on a first test coming back. And I say, oh, good answer. They better come back negative after you've done your detox programs. But the first one, it's very rare to get one coming back negative because we're all being exposed all day, every day to so many environmental toxins. So I'm going to do a couple more questions just to get warmed up a little bit more. I seem to be okay with gluten. I have 0 health issues and I'm 61 at my ideal weight. So I think that I've proved you wrong that it's not every single person. You may want to say most people. That's a really good point. And I think I answered that question from Justina last week. So that's all the questions that have come in today. No, actually, there's some more down below. But to Justina's question, for those that didn't hear the answer last time, it's a valid point. That may be the case for you, and way to go if that's the case. But the only way you know for sure is to do a autoimmune panel to see, is my immune system fighting my own tissue? Is my immune system fighting my brain? That's the Neural Zoomer Plus. And I've never had a normal come back on a first test on anyone. That for all of us, that's why cognitive decline in Alzheimer's is going through the roof. The Alzheimer's Association says 1 out of 3 elders will die with dementia. 1 out of 3. So the only way to know for sure, Justina, on that topic, and thank you for saying it the way you did, because you might be right and you can feel really good about how you're functioning. That's great. That's what you want. And if you really want to know, to nip something in the bud, you would do an autoimmune profile. There's 2 tests that I could recommend. The first one would be the Neural Zoomer Plus for your brain, because in my book, that's most important. And then from Cyrex, array number 5, that looks at 24 different tissue antibodies, 3 to your thyroid, 4 to your heart, 6 to your brain, your lungs, your liver, your kidneys. It looks to see, is your immune system fighting your own tissue? So that's an autoimmune panel. So between those 2 tests, if they come back negative, well, we should write a book about how you live your life, because you're doing really well, really well. I have long-term autoimmune disease, starting with type 1 diabetes 54 years ago, plus 4 others, including autoimmune gastritis. Although I always seem to be working on the gut microbiome issue, taking supplements and food for what I lack, it occurred to me recently to ask even if it is even possible to get the microbiome working appropriately with autoimmune gastritis for almost 20 years. Yes, Sue, it is possible. And I've had a couple of patients like that over the years. And I did an interview today for my friend, Dr. Pedram Shojai, for a summit he has coming up. And we talked about a topic that I'll bring up here. When I have a patient, and I see about 1 patient every 3 weeks now, it's on Zoom, but only the really difficult cases that aren't getting the results yet with everything they've tried. But when I see people and who have, I've been everywhere, I've seen everyone, I've done everything, I've spent tens of thousands of dollars, I'm not well yet. Then without exception, every single person has had this as a component, a major component of what they're dealing with and what's causing their resistant symptoms. I call it the emergency brakes. You back out of a driveway and you say, what's wrong with this car? It's not moving very well. The emergency brake. And you let go of the emergency brake and you back up just fine. So the most common emergency brake for those types of people with those types of symptoms. I often talk about the pyramid of health. And if we look at a pyramid, it looks like it has 3 sides to it, but it really has 4. There's a base, and that's your structure. And that's the home of chiropractic and massage and exercise and posture and the type of beds you use and the type of pillows you use. All those things make a difference that can contribute to or be a primary cause for any symptom in your body. We've seen so many miracles over the years with chiropractic, just pure spinal care, that are jaw-dropping. Sometimes that's the missing link. So that's the base of the pyramid. And then one side is the biochemical. That's where most of us live, with focusing on what we eat, we drink, what the air we breathe, the pharmaceuticals, the nutraceuticals. And then one side is the emotional or spiritual. We call that stinking thinking. And the last side is the electromagnetic. And so whenever you're dealing with a health problem, you have to look at all four sides. And usually there's a combination of emergency brakes that are holding back your progress. But for people that have had many conditions and they've seen lots of docs and they've tried lots of stuff and they're not getting total results yet, the one side of the triangle that they refuse consistently to do a deep dive is the emotional or spiritual. And that's the one that's the major emergency brake holding back their progress. Because whatever the trauma was that happened at whatever age, we didn't have the tools at that age to deal with it in a non-damaging way to our own body. You know, you hold it in. You know, if you have some kind of stress or anger or fear, you don't express it, you hold it in. Where do you hold it? You got to hold it somewhere. And that kind of tension accumulates and it can cause any health problem whatsoever. And when I see people who have been everywhere and done everything, that side of the pyramid of health is critically important to bring right up front. And it's terrifying for people to look at. It's really terrifying much of the time because we're not thinking or we're thinking, but we're not feeling with our big boy pants. You know, we're still in that space of being a kid that was traumatized or at whatever age it was where we couldn't deal with it. We revert right back to that anytime something looks familiar or similar to the trauma that we experienced. So that's something I would definitely look at on your long-term autoimmune diseases that you have, especially the gastritis. What is it that you can't stomach in life? You know, I'm not being cute. They're often you're holding it in your stomach is a very common venue. And for that, the two people I'd recommend you explore, just go to their websites and look at them. Dr. Silva Dvorak, Dvorak, Dr. Silva, Sylba, Dvorak.com, and MartinaFinitary.com. Both wonderful, wonderful practitioners who are not going to talk to you once a week for the rest of your life and do therapy. They're going to help you create a safe space to go in and take a look at this, whatever it is, where you're safe. And you can come up with new venues of how to deal with that kind of stuff when anything comes up that reminds you of that energy. They're very powerful, the work that both of those women do. Are the Zoomer tests best for helping to determine cross-reactivity? Yes. In terms of there's the lectin Zoomer, the corn Zoomer, the soy Zoomer, the dairy Zoomer. Yes. Cyrex has array number 4, which is entitled cross-reactivity because it looks at some of the foods that are commonly cross-reactive with wheat and with dairy. But the Zoomers themselves are much more comprehensive than the arrays from Cyrex. But yes, they certainly can help you with that. And once again, there is $60 off all the labs, and the code is WHEAT, capital letters WHEAT 60. So if you've been thinking about some tests, now might be a time that you might want to consider that. Christina on Facebook asks, when you put someone on a gluten-free diet, do you include oats, corn, and rice as well? Thanks, Dr. Tom. No, Christina, no, not usually. It's gluten-free, dairy-free, added sugar-free, with a lot of explanation about the gluten-free and what that means. And I'll go back to that in a minute. And I'll say to them, you know, within a month, if you aren't noticing that you're feeling better, 3 weeks is my bottom line. You better notice within 3 weeks you're feeling better. But within a month, if you're not, then let's take oats out also and corn and rice. And let's just get those out of there because they're familiar. I won't say often, but common cross-reactive foods. And what cross-reactivity means is that if you have a sensitivity to corn, in 50% of celiacs, you'll make more wheat antibodies when you eat corn. That's cross-reactivity. We don't put them on grain-free right away, or we'll let them eat any grains with an explanation about contamination and the necessity of using enzymes. And I'm going to be talking about enzymes in just a couple of minutes. But within 3 weeks, 3 to 4 weeks, if they're not noticing they're feeling much better, then we'll take them grain-free and still using enzymes and see what that does for them. That's pretty common. It's common that people start feeling better, but not quite as much as they want. And then they go grain-free and all of a sudden they feel like $1 million. Jane asks, my neighbor has thickening of the skin on his nose to the extent that his nose now looks quite different. His doctor doesn't have a clue why or what's causing this. What do you think may have caused the skin thickening? That's a really good question. It depends on his history. Does he have a history of sinus infections? Does he have a congestion? Does he cough regularly like this? Or is he doing this all the time and he's just got mucus and congestion in there? It depends on the history of the patient and what you're looking for there. What about appeal placed on organics now to allegedly keep them looking good in the stores? I'm not familiar with that. Sorry, I can't comment on it, Sharon. Don't know what it is. Nancy asked, could you give the names again? I'm not sure what names you're referring to, Nancy. So write it down what you're referring to and I'll come back and see what you say. So one of the things I wanted to talk about tonight, because I think a lot of people here are gluten-free or considering gluten-free. And the way you know is to do the wheat zoomer. There's no test in the world that's as comprehensive as the wheat zoomer. Absolutely. I got to show you this. Look at that one. My wife and baby are outside. They're waving like the sun's setting and it's beautiful out there right now. But that was a catcher. Gluten-free. Yeah, the wheat zoomer. There's no test in the world that's as accurate. And the technical term is sensitivity and specificity for our healthcare practitioners out there tonight. And when I'm on stage, I'm often encouraging doctors to do double-blind tests on their laboratories. Well, what does that mean? It means when you draw blood on a patient, draw a second tube of blood out of the same blood draw, the same venipuncture. Label the second tube Joe Smith. Send it into the lab in a separate envelope, ordering the same test you're ordering for the patient whose name is the patient's name. You have to pay for that second test yourself, doc. You know, you can't charge the patient, you can't charge insurance. But when the results come back, you're going to see how accurate your lab is. And I suggest a minimum of 3 times to do that. So you have to buy 3 tests yourself, pay for 3 tests yourself. But if you find that 1 out of 3 times, the tests are completely opposite, the test results are completely opposite, that's the quality of the lab you're using. 33% of the time, it's wrong, completely wrong. And it's jaw-dropping when you see this. It's like, what? Which test do I talk to the patient about? The one that has their name on it where everything's fine? Or the same blood, Joe Smith, that says, you got a real problem here. What do I do? I was left with that dilemma many, many times. And what that means in technical terms is the sensitivity and the specificity of the test is not very good. Most of the tests our doctors are using today come out from technology in the 1970s, the 1980s, the 1990s. It's okay. Usually sensitivity and specificity is in the 70, 75% range, which means it's wrong 2 or 3 out of 10 times, you know. But technology improves. And silicone chip technology came out in 2015, and it's cutting edge. The sensitivity is 97 to 99%, and the specificity is 98 to 100%, meaning it's right on the money every time. So when you do the Zoomer test, you can be assured, as long as your immune system is functioning adequately to respond, meaning if you're not making enough antibodies anymore, your total immunoglobulin count is low, you can't check immunoglobulins. You can't check antibody levels for thyroid or for your brain because you're not making enough antibodies anymore. Your immune system's worn out, or you're on steroids, which suppresses the immune system. You can't do these tests if you're on steroids because they're likely not to be accurate. But now, for the vast majority of people, we have tests that you can use that are right on the money every single time, irrespective of how you feel. Sensitivity and specificity is that high. And when you do those types of tests, you find out, is my immune system fighting wheat? Because it doesn't matter whether you feel bad or not when you eat a particular food. What matters is your immune system using its precious energy to make antibodies to fight that food, eggs or dairy or soy or lectins or wheat? Is your immune system using its precious energy, and you've got elevated antibodies to that particular food? Because when you have elevated antibodies to that particular food, antibodies are special forces. You know, they're highly trained, specific, with high-powered rifles to go after whatever they're trained to go after. They don't go after anything else. They go after wheat or lectins or whatever it is that you're testing for. Well, how does the antibody know in your bloodstream's a highway? It's just a highway and everything's going the same direction, but there's no lanes of traffic. Everything's bouncing into each other. How do the antibodies know what to attack? Because they're looking for a particular amino acid structure. Amino acids are like a brick wall. They're looking for particular bricks in the brick wall. If there's a combination of red bricks, that's what they're trained to go after, for example, is red bricks. And wherever they see red bricks, they're going to attack and destroy that thing. Well, unfortunately, human tissue is also made up of red bricks. Looks the same as the outer surface of a bug or the outer surface of wheat. So the antibodies that are trained to go after red bricks, they look over there and they fire their chemical bullet at your thyroid, if that's your genetic vulnerability, or at your knees, the collagen on your knees, rheumatoid arthritis, if that's your vulnerability, or to your myelin, the saran wrap around your nerves, multiple sclerosis, if that's your vulnerable link. But it's molecular mimicry is when the structure of the food looks enough like the bricks, the amino acids of your own tissue, that the antibodies to the food can say, look over there, and they go after your own tissue. And that is a primary mechanism in the development of almost every autoimmune disease. Primary. Just Google rheumatoid arthritis and bacteria. Here come the studies. Multiple sclerosis and bacteria, or multiple sclerosis and wheat. Here come the studies. Cognitive decline and dairy. Here come the studies. You see it again and again and again. That's why it's so valuable to find out what foods are my immune system fighting right now. And for most people, the test that I would recommend, and it would be in this order, would be Wheat Zoomer, Neural Zoomer Plus, Gut Zoomer, Dairy Zoomer, Lectin Zoomer, and then Environmental Zoomer. Those 6. That's the order. Wheat, Neural Zoomer Plus, dairy, lectin, environmental toxins. That's the order that I would do them in for most people, because they're the most common ones that are larger emergency brakes holding back your efforts to get healthier. They're the most common ones. And once again, the testing is $60 off, and the code is WHEAT, all capital letters, WHEAT60. Jill has a question. Dr. Tom, I'm going to be visiting my son and staying at his house. What's the best way to wash dishes and pans that I'll be using at his house? I want to make sure there's no gluten residue. Oh, that's a really good question. I don't have any knowledge of different dishwashing soaps that are more effective than others. I'm sorry, I can't help you with that, but I can tell you what we do. I don't do it often, actually, ahead of time. When we get to like an Airbnb we're renting or something that's got a kitchen in it, I'll stick my head in the dishwasher. You know, I'll open it, I stick my head in there. If I smell anything, I go out to the store and I buy some bleach. And I pour a cup of bleach in there and turn it on and just kill anything that's in there. And I do the same with a washing machine if we're staying somewhere for a couple of weeks that has a washing machine. Because the average amount of feces in the underside of the lid of a washing machine is 1/8 of a teaspoon. What? Just read the science, you know? When you read the science, because water splashes and some of it gets on the inside of that lip of the washing machine. So I put a cup of bleach in the washing machine and a cup of bleach in the dishwasher and turn them on and, you know, just clean them out. But in terms of what soap to use, Jill, I'm sorry, I don't really know about that. My son has eosinophilic esophagitis and tries to avoid gluten, but inevitably ends up eating it because he's so hungry. At this point, he reacts to every single fruit and vegetable, plus every type bean and legume. Also can't eat seafood or nuts. He plays college baseball and can basically only eat meat, chicken, rice, pasta, and bread. I'd so appreciate your thoughts. He needs to see a good doctor, Carla, because you can put your toe in the water and maybe he'll help a little bit, but he needs to work with someone that knows what the hell they're doing. Excuse me. But chronic eosinophilic esophagitis is a precursor to esophageal cancer. You don't want to have this kind of stuff going on long term. You just don't want to have it going on. So you need to nip it in the bud. And medication, it's not a deficiency of medications he's got. It's food sensitivities, environmental toxins. Sometimes they're already in the body and you got to get them out. But sometimes it's also what's out there and you have to stop putting it in. But he needs to work with someone on that. I don't mean to be evasive, but this is not something that you can put a toe in the water and do something that's going to help a little bit. Lynn Ann asks, in reference to the Zoomers, when you say steroids, do you mean oral only? No, I use budesonide in nasal rinses. Yeah, no, it's going to suppress your immune system. I don't know if it'll suppress your systemic immune system if you're only using nasal rinse, but stop using the steroid. Or I said that wrong. Find out why your body needs steroids in a nasal rinse. What's going on in your head? What's the bacterial content? What's the oral mucosa? You know, there's hundreds of families of bacteria in the oral mucosa, and we swallow 1 liter a day of saliva. 1 liter a day. Think of a liter. That's how much saliva we produce during the day, and we swallow it. So if you've got bad bacteria in your mouth, you get bad breath, you got a bad taste in your mouth and any of those kinds of things. And the saliva that you're swallowing all day is inoculated with all this bad bacteria, which can trigger eosinophilic esophagitis, or it can trigger gastritis, autoimmune gastritis. You know, you have to be examining where is the problem coming from. So on the topic of enzymes, some of you have heard me talk about the study in the past from the American Journal of Gastroenterology in 2019. This was a great study. They had 800, this is from Columbia Celiac Research Center, and they had 804 people that they gave testing equipment to, and they sent them out into the community to order food from gluten-free menus. And they were told to order 7 foods each. So that's 5,624 different foods, 7 times 804, 5,624 different foods off of gluten-free menus. And when the waiter or waitress walked away, they opened their briefcase, put the testing equipment on the table. When they came back with the food, they took a cartridge, they put a sample of the food in the cartridge, put it in the machine. Is there any gluten in here? And they did that with all 7 foods that they ordered. So 5,624 different foods. What do you think the results were? 32% of everything on a gluten-free menu is not gluten-free. Let me say that again. 32% of everything on a gluten-free menu is not gluten-free. 51% of gluten-free pasta is not gluten-free. 54% of gluten-free pizza is not gluten-free. Well, wait, it's a gluten-free restaurant. It says right here it's gluten-free. They don't know. They're not lying. They just don't know that the raw materials they're using are contaminated. That's why it's impossible to eat gluten-free when you go out in the world. It's just impossible because there's so much contamination that's going, and it only takes an eighth of a thumbnail to activate your immune system. If you get that much wheat, Tricia Thompson, who does great work at Gluten-Free Watchdog, she bought some bags of lentils and organic lentils, and she opened a bag and put it on a baking tray, spread it out. And she looked, and she found in 4 bags of lentils, she found 3 kernels of wheat. And a kernel of wheat is all it takes to activate the inflammatory cascade in you. So you're eating lentil soup, but you got that 1 kernel of wheat. Your immune system picks up on that. You've got elevated antibodies for 2 months, a minimum of 2 months when that happens. More inflammation, more inflammation, more inflammation. It is almost impossible to eat gluten-free out in the world. That's why we put together the digestive enzymes that we did, because you need protection. There's 2 enzymes that we've put together. The problem with most gluten enzymes out there is that they take 3 to 6 hours to work. They work in an alkaline environment, but in your stomach, it's acid. In the small intestine, it's acid. So those enzymes don't work in that environment. But by the time the food gets down to your large intestine, it's a more alkaline environment, and those enzymes work really well. So they'll protect your colon from colitis, but they will not protect your stomach or your gut, your small intestine from irritable bowel syndrome and Crohn's disease and bloating and gas. They won't do anything for that because they don't work in an acid environment. And some of you have heard me say before that the sentries standing guard that are watching everything that comes out of the stomach in case there's a bad bug or something are right in the first part of the small intestine. And they're watching there for anything. They're called toll-like receptor 4. And whenever they see something that looks like a bug, they immediately do 2 things. They activate the production of more zonulin, which creates the leaky gut. And so water comes into the intestine to wash out the bug with the poop. And they activate NF-kappa B, the major amplifier of inflammation, to kill the bug. So it's a 2-fold protective mechanism we inherited from our ancestors. And those toll-like receptors, those sentries, are standing right inside the first part of the small intestine, scanning everything that comes out of the stomach. Well, the gluten enzymes don't work until the enzymes get further down into the large intestine. So that means that you don't stop this whole inflammatory cascade in the leaky gut, the gateway in the development of the autoimmune diseases. Your enzymes don't have anything to do with that. We came up with enzymes that work in the stomach within 60 minutes. And food takes 90 minutes to 2 hours to get out of the stomach into the small intestine. And it digests 99%. We can't say 100% because there's always some atomic level. It digests 99% of the top 8 allergens: gluten, dairy, soy, corn, egg, shellfish, fish, and something else I'm forgetting. But within 60 minutes, 60 to 90 minutes, it digests it all, 99% of it. So whenever Marzi and I go out to eat, if there's any sauces of any type, or if we're ordering gluten-free pasta, we do that for Gio a lot, and I'm going to take a few bites of it. If I'm ordering risotto, I love risotto. We always take our enzymes. We take the enzymes before we start eating. So they're there waiting in case anything comes down that's contaminated, to deal with the contamination issue. And there's 2 separate enzymes. The first one is E3 Advanced Plus. And the second one's called Wheat Rescue. We'll put the links there for both. And we take both. You know, Marzi has both in her purse. And so I just, to be safe, I take both. E3 Advanced Plus also contains what are called bacteriophages. Now, some of you know that you've got more viruses in your gut than you do bacteria, and you have more bacteria than you do human cells. So we have hundreds and hundreds and hundreds of viruses in our gut, and that's normal. Viruses aren't bad for you. Bad viruses are bad for you. And so bacteriophages are viruses that attack bad bacteria. They go after bad bacteria, and they do a really great job of just destroying bad bacteria that might be in your food or that's in your gut right now. So E3 Advanced Plus has bacteriophages. So anyone that has gut symptoms in general, whether it's bloating or gas or abdominal pains, E3 would be the one that I'd recommend for you, because the enzymes are there to digest the top 8 allergens, right? But also bacteriophages. For those that don't have stomach problems, you're dealing with brain problems or thyroid or joints or something else. Wheat Rescue has a little more digestive power, not just for gluten or the top 8 allergens, but also a little more hydrochloric acid and a little more pancreatic enzymes, just to help overall with all food digestion, and does not have the bacteriophages. So if you don't have gut symptoms, you don't need the bacteriophages. That's each 3. And for those people, Wheat Rescue is probably a little more supportive. They're both great for you. You can't go wrong with either one. And as I said, Marzi and I take both. We tend to not blame trauma for contributing to our physical condition because of the stigma it causes within the medical profession. I lost my wife as a result of a car accident in 1974. Oh, Colin, I see it's you. I'm sorry, man, for the trauma. There was no help back then for the trauma. You just learned to live with it, but I still believe that that trauma is part of my present physical symptoms. Good for you, man. Good for you. You've shared with us some of your symptoms in the past. I fully agree. Colin, I think you'd really like Martina Finnery. She's in a small village in rural Ireland, and I call her a white witch. She is just the best. I just love her. She's such a beautiful person. And every morning she goes down for a swim, summer or winter, in the river, whatever the river is that runs from the north to the south of Ireland. She calls it the blood of Ireland, that river, because it runs through the entire country. And she's that kind of a person, just a purifying, just a solid person. Colin, I think you'd resonate with her really well. Please consider giving her a call and use my name and tell her I send my love, and let me know if you do how it goes for you. I have a blocked salivary duct. Besides drinking a lot of water, massaging the areas, or anything else I should do? It's been about 5 days. Yeah, Jill, I'd wonder about your oral microbiome. And I'd also use castor oil packs, face mask, castor oil packs. We'll put the link in here for that. There's 2 kinds of castor oil packs I'm aware of. One is for your belly, or you can use it on your leg or arm or something. And the other is a face mask. And I would use the face mask castor oil pack, and I'd work your oral microbiome. Lynn Ann asks, do you use these enzymes with all meals or just when you go out to eat? Depends, Lynn Ann. When we eat at home, I don't use the enzymes unless I'm using a bottled salad dressing or a bottled chichimanga spice, or something like that that's labeled gluten-free, but I'm not going to take a chance. If I remember, quite honestly. Sometimes I don't remember, but we're really careful about it in general. So I don't take it with all food unless if you need a digestive enzyme, just in general. And it's called the 40-40 rule. By the age of 40, most of us are only making 40% of the hydrochloric acid we should be making. That's why I put some extra hydrochloric acid in the Wheat Rescue, is that it helps you digest all your food a little bit better. Rosemary says, I had a hip replacement 3 years ago. Can I still get a spinal manipulation? Yes, of course you can. I've had many patients with hip replacements. I've arthritis in my neck, shoulders, and back, spinal stenosis also. Yeah, you'd probably do very well with the right type of gentle spinal care. There's a type of care called flexion distraction. And the main proponent, who's trained tens of thousands of doctors, is James Cox, C-O-X. So it's Cox, flexion distraction. And when I was in school, I had a flexion distraction table that was in my living room. It was our sofa. You know, we put a Indian rug on top of it, and that's where we'd sit down, but it was really a table. It was a 1924 McManus table. I was so proud of that table. But, you know, I do flexion distraction on people in our living room. And that type of care, Cox flexion distraction, is profound with spinal stenosis. I don't remember the studies now, exact numbers, but I know what comes up for me is 32% of all spinal stenosis patients feel much better with Cox flexion distraction, some number like that, you know, somewhere around 1 out of 3. And you should be able to Google COX, Cox flexion distraction, certified practitioners, and find someone in the area you live. Why you recommend wheat, dairy, lectin, zoomer tests instead of food profiles 1 and 2, IgG and IgA? Because the technology of the food profiles, IgG and IgA, is called ELISA, E-L-I-S-A. And that technology is from the early 1980s. And it's good technology, but it's wrong 2, 3 out of 10 times, if not more often. Whereas the silicone chip technology is 97 to 99% right on the money every single time. And that's why I spoke about doctors doing double-blind testing so they can learn for themselves the accuracy of the labs that they're using. Will the Zoomer for wheat test show sensitivity if you've been gluten-free and dairy-free for at least 3 months? Yes, absolutely. What you want to do is confirm that what you're doing is working. So if you've been gluten-free for 3 months, and I assume you've noticed some changes for the better, whatever they might be, if that's the case, then you know it's working, right? And yeah, you do the test to see if you're being successful. And the vast majority of people are not, because they're better, but they're still getting exposures because of the contamination issues we just spoke of a few minutes ago. What's the best test for brain inflammation and or risk of dementia? Absolutely no question. It's the NeuroZoomer Plus, without exception, the very best test. Right on the money, looks at 53 markers of inflammation in your brain. Nothing like it anywhere in the world. I'm so proud of that test. And I had a little something to do with it, not much, but a little something. At the time, the test came out called the NeuroZoomer, which looked at 8 markers of inflammation in the brain. And then Marzi and I got married, and we came here to Costa Rica, actually to this complex that we're in, for our honeymoon. And we spent 6 weeks here. You know, I can be anywhere as long as I have internet to work. And I read 93 research papers on the blood-brain barrier in 6 weeks. Laying in the shade, looking at my wife, sunbathing, just so grateful and thank you, God, how great. And I'm reading these research papers and highlighting it. And so when we got back, I wrote to the lab and I said, hi, it's Dr. Tom O'Brien. Your NeuroZoomer test is great, you know, the 8 markers of inflammation in the brain. But do you guys know about the ganglioside 1 to ganglioside 3 ratio? No. And I said, well, here's a study. What about cerebellar peptides? You're not checking those. Well, should we? Here's a study. And I sent them a bunch of papers. 8 months later, they come out with the NeuroZoomer Plus. You know, it took them that long to validate and to get the test right. The NeuroZoomer Plus looks at 53 markers of inflammation in your brain. No test like it anywhere in the world that I'm aware of. And I've not lectured in the Far East, so I can't speak for that, but I'm all over Europe lecturing. I go to Brazil in 3 weeks, and Rome in 6 weeks, and India in January. You know, so I look at tests all over the world, and nothing compares to these. The NeuroZoomer Plus and the Wheat Zoomer and the other Zoomers, they're just spectacular tests to use. And right now, it's $60 off on all the labs, and the code is WHEAT60, capital letters, WHEAT60, for $60 off on all the tests. Can gluten cause benign heart palpitations? Absolutely. I was privileged to write a chapter in 2 different medical textbooks on integrative cardiology. about a year and a half apart. And study after study where I show that in some patients, it's a sensitivity of wheat that's causing their palpitations. Not always, but sometimes. And in others, their ejection fraction, the power of the heart pushing blood out, goes up dramatically because they've got congestive heart failure. But you go gluten-free and it goes up dramatically and they get much better. So yes, absolutely, it may be the case. And all you have to do is do the wheat zoomer to see if your immune system's fighting wheat. Then you get off of wheat and then you notice how your symptom patterns are. The other thing for heart palpitations to keep in mind is if you have a smart box outside your house. Do you remember I talked about the pyramid? Structure, emotional, spiritual, biochemical, and electromagnetic. You have to deal with electromagnetic, especially for heart palpitations for some people. That's the missing link. And are the Zoomer tests available in the UK? Yes, they are. You have to deal with shipping them to back to the US yourself, but you can get them. Our staff can send you the test kits and coordinate the paperwork, but you'll just have to deal with shipping it FedEx back to the lab. And the last question. Oh, wait a minute. There's two questions. Hi from Tampa, Florida. Your colostrum is an amazing product. How long should I take it for gut problems? Well, you know, this is the one thing that I disagree with Dr. Andrew Keach on. Andrew is the PhD that he grew up on a dairy farm and learned in New Zealand, learned early in life, if you don't give newborn calves colostrum, they die. You can't give them milk, they die. And they found out that if you give humans colostrum when they're sick, they get better. And so he decided he wanted to make the best colostrum in the world. So he went to Oxford and got a PhD at Oxford in mechanical engineering. And I said, Andrew, PhD at Oxford, way to go, man. High five, way to go, high five. But mechanical engineering, what? Well, Tom, I knew I was going to make the best colostrum in the world and no one was doing it. And if I was going to do it, I was going to have to learn how to build the equipment to do it. And he did, And his colostrum is the best in the world. It's licensed by 3 countries in Europe, maybe more now than 3, as the treatment of choice for HIV. When someone's diagnosed with HIV, the government pays for them to get colostrum because it strengthens your immune system, balances the microbiome. It's just the very best. So all that to the benefit of colostrum. We'll put the link in here for you for the colostrum. The same colostrum that the governments of Africa license as the first treatment for HIV positive patients. But Andrew takes colostrum every day. He takes about a 12-ounce glass, half full of colostrum, and adds water to it every day. And I said, well, Andrew, but there's no animal on the planet that drinks colostrum after infancy. Well, I can understand taking it for a while, but continually, I'm not sure. He says, well, Tom, I think you can. So that's the only thing that I disagree with Andrew on. So my recommendation, take it for 3 weeks, take a week off. Take it for 3 weeks, take a week off, take 2 weeks off. You'll want to go back to it. We do it regularly. Gio now loves his cashew milk. You know, he loves, he's being weaned off the breast now. It's going very well. And he gets a little glass of milk and he loves his cashew milk. And Marzi puts a scoop of collagen and a tablespoon of colostrum in his milk and a little Bialetti blender. And he just drinks it right down. And I'm so happy that he does. You know, he just loves it, but he's getting all this nutrient power. And so the answer is, I don't know if there's any problem with taking it every day, ongoing, but because in nature, there's no animal that does that, I'd say take a week off every once in a while. You aren't going to be harmed if you do that. Would you be able to see my son for eosinophilic esophagitis, or would you know of a good doctor elsewhere? Virtually, I'll do anything I can to help him. Way to go, Mom. Way to go. And the answer is yes. If he's willing to do the work, you know, if he's willing to learn, not do what I say, but take time to learn about the rationale as to why this is what you want to do right now. First, we have to do some tests, but then Are you willing to give this a shot? If he's not, don't waste my time, excuse me, but it's my reputation. If he is willing, if it makes sense to him to give it a shot, then absolutely, absolutely. Just go to info@theDr.com and tell him that I said that. Okay. And do the Zoomer tests also give recommendations for improving your health issues along with the Zoomer test result? Yeah, they do. There's a number. Plus, we have three practitioners that I've interviewed. We had lots of applications, and I chose 3. If you wish to do test interpretations, you can order the test from us, and the lab results will give you some recommendations. But we also have 3 practitioners. They're not associated with theDr.com. I have no connection with them whatsoever, but I'm competent in their knowledge that they are trained well in interpreting the tests. So we can give you those names also when you get your own test results. Although casein often mimics gluten, is there a possibility that individuals non-celiac gluten sensitive might not have issues with dairy? Yes, it is possible. Would you recommend testing to confirm this? Yes, because it's very common to have increased antibodies to peptides of poorly digested dairy. Very common. Cow's milk is 8 times the size of human breast milk. Goat is 6 times the size. The animal milks that are less likely to cause a problem are camel, donkey, and reindeer. And camel milk is certainly possible. Anne may have the link. I think it's Desert Farms, Anne. And we want to talk to them about our upcoming event too, Desert Farms. They're great people. And the camel, it tastes really good. Tastes really good. I met them at a conference one time, and I talked to him for a while. And I think they're a Quaker. I think so, but maybe not. But kind of have that kind of beard and the pants and shirt, but really just kind people, really nice people. Well, can we send you some milk? I said, well, okay, thank you. I gave them the address, and they sent the milk, and it was in my refrigerator, but I just, I don't drink milk anymore. And so I travel a lot, and when I got home, it went bad. And I saw them a few months later at another conference. What'd you think of the milk? And I said, I'm sorry, it went bad. I was traveling so much, it went bad. Well, we'll send you some more. And so they did. And I tried it. It was really good. With gluten-free granola. It was a nice treat for me. So camel's milk, it sounds weird, but think of cow milk, and we're just accustomed to it. But camel's milk is really delicious, and it's a low allergen type of milk. I had LCAT testing for food sensitivities in 2012. Would those results still be accurate? No. Is LCAT testing still used? Yes. Do I use LCAT testing? No. The Zoomers are the most cutting edge modern technology available. The sensitivity and specificity is second to none. And the way you'd really know, and I don't recommend people do it, but the way you'd know is that you do 2 tests, 2 LCAT tests, but label one with a second name. Same blood draw, but make the next one Joe Smith and see how the results are. Then you can count on the results or not when they come back if they're the same. All right, everyone. Thank you so much for being here tonight. Really a pleasure to be with you. And I will see you again next week. Bye-bye.